So welcome to this session, which is an international perspective on net zero. I'm delighted to introduce Sophie Meisser to you, who is the sustainability lead for Geneva University Hospitals. And I'm Sonia Roschnik from the Geneva Sustainability Centre, which is a new centre that's been set up and powered by the International Hospital Federation. I hope that we can both invite you into an international perspective. I know that in the UK you are doing an awful lot of work on trying to achieve a net zero across the NHS, and we're very pleased that you are setting a great example. We're here to talk a little bit about what's happening elsewhere, and I hope this will be of interest to you. Don't know if you want to just say hello, Sophie.
Hello, thank you for inviting me, Sonia. I'm very honored to share this discussion with you and to explain what we did for the past 2 years in Geneva University Hospital.
Excellent. Thank you so much for being here. It's great to have you. So thank you very much for joining this international perspective on net zero. I'm going to run through a few more points about the international context before we ask Sophie to give us some more information on what she's been doing in the University Hospitals of Geneva. I think you might be interested in the process that they've been through as a means of engaging with their staff and the public and patients on how to sort of determine what the strategy really needs to be and how to get everybody involved in taking action. But in the meantime, I just wanted to highlight really that the International Hospital Federation is an organization that's been in place for since 1929, so it's been there to support hospitals for a long time, and is really focused on making sure that hospitals are well led and well managed so that we can make sure that we have very high quality healthcare available everywhere. And this year, the International Hospital Federation has decided that one of the key strategic objectives going forward needs to be around sustainability of healthcare and what needs to happen around the climate agenda. So they've set up the Geneva Centre of Healthcare Leadership, which is really going to be focused on supporting chief executives to develop the skills they need to be able to lead sustainable and low carbon or net zero organizations. And this is a real opportunity to embed sustainability and carbon reduction in everything that an organization does. And we'd love to hear from you about what that might need to look like, what you think chief executives most need to help everyone do this job, not only well, but to accelerate action on it and make sure that we use the remaining years that we've got. I think it's 3 if you consider the IPCC report that says, we really need to make a difference in the next 3 years. Then we need to be sure that we're focusing on the right actions in the next 3 years. So why this is important is that obviously the healthcare footprint globally is 4.4% of global emissions. This is the size of a country. It would be 5th country in the world if you put it up as one country. So this is a sector in its own right that really needs to do its best to reduce the impact on the environment. And although we have a mission to deliver healthcare and to deliver quality healthcare, I really believe both of those are aligned and can be done in one element. So reducing carbon emissions is pretty key. And it's quite there is a huge differentiation of responsibilities around this because some countries have got much higher emissions. So the United States, for instance, produce nearly 1/3 of the global emissions of healthcare, whereas obviously some other countries are still very much trying to develop their health service and aren't contributing as much. The sort of staggering thought is that the emissions worldwide are going to treble by 2050 if we don't do anything about it. So we really need to be reducing the emissions of the healthcare sector, because it's a growing and expanding business in reality, with a growing population, more elderly people, and changing disease patterns, greater expectations as well. We really have to find every way of not just stopping the rise in the emissions, but really bringing it down as close to zero as possible. And that means that everybody's going to have to be involved, and we'll really have to tackle it in every decision that is made in healthcare. So the good news is that following the the NHS example of setting a commitment for net zero and developing a very detailed plan around this, there are over 50, I think it's now 57 countries that have signed up to make sure that their system has set a baseline carbon footprint, and they're starting to reduce their carbon emissions, that they've got an action plan or a roadmap around that. 14 countries have actually signed up to a net zero commitment as well. They don't necessarily know exactly how to go about it, but there is this ambition now that everybody recognizes this is urgent and that it is aligned with what healthcare needs to do. And I'm really hoping that we can open up a collaborative space about how best to do that. I really welcome the Greener NHS link up with WHO to support countries that are committed to net zero to accelerate action and do so in a robust way. It is a real world of inequality though, and if you look at where the emissions come from, mostly you'll see that it's quite a northern bias. The UK is high on here, the whole of Europe is high, the States is high. We've got a lot of we carry a lot of responsibility around how we reduce emissions. But if you compare this to where the vulnerabilities are, it will really give you a sense of how unequal this world is. And because it's actually Africa, Southeast Asia, and Asia more generally that are suffering the most from climate change. So we really, really need to be doing something in terms of our world citizen responsibility to reduce this, not only reduce the emissions, but reduce the vulnerabilities and reduce this huge gap there is. So that's why in Healthcare Without Harm published a roadmap for global healthcare decarbonisation, which really suggests differentiated responsibilities, where those that contribute the most emissions should be on a very rapid decline pathway. And the NHS pathway is very similar to this yellow one here. That's what most Western countries and more resourced hospitals need to be doing around the world. Whereas others that are still trying to make sure that they've got access to universal healthcare in their country do need to be able to do so in a low carbon, resilient and just way, but will need a bit more time to do that. The reality is everybody needs to get to net zero by 2050. So we all are on this journey together. So obviously there's the great example that the NHS has set, but I would also like to highlight that there are lots of other fantastic examples around the world. And the one that we talk about a lot is the solarization of clinics, because it's an excellent example of how you can decarbonize the provision of energy for clinics, but also make them less reliant on the grid, which provides them with greater resilience and often the ability to expand their service and see more patients around the world. So you do have solutions that can help improve quality of care, improve the numbers of patients that can be seen, and that it can be done in a low carbon and resilient way. So I'm going to hand over to Sophie now, and we'll pick up later with our conversation. Thank you very much. Over to you, Sophie.
So here in Geneva, when I arrived 2 years ago, I really did an assessment of what has been done so far, because Geneva University Hospital has a long history in environmental commitment. It went way back in the beginning of the 2010s with a mobility plan for employee. There were also an eco-performance evaluation done and a few CSR report done in the middle of the 2015 and 2016. And at a strategic level, already in 2015, the institutional strategic plan included CSR objective. And the idea was really to see where we were and to have really a strategy in place. It was something our board of directors wanted. So first, really the idea was to develop a whole strategy, including everybody, the employee, but also the general public, the patient, and all our stakeholders. So it began 2 years ago with really CSR diagnostic about our practices and level of commitment in climate change, but also environmental impact in general, social maturity, and also the economical aspect. So it was the whole story, not only climate, but you will see that climate is important in our journey. We had also to constitute a commission dedicated on sustainability. We didn't have such a commission so far. And after setting the definition, defining the priority and orientation, we really went through collaborative elaboration of the strategy. The evaluation we did in 2020 showed that as a public hospital, we were quite good on the social and societal aspects. Good also on economical and governance aspect, because as a public entity, we don't have to, we have a lot of business ethics, things in place for procurement, public procurement, and so on. Environmental aspect, and especially climate impact, were really the part we have challenges and we have to improve. And based on that, the CSR committee decided to define, and it was also something that the managing committee validated, 3 strategic priorities. First one was climate and health. The second one was based on equality, diversity, and inclusion. And the third one is on sustainable consumption and production. These 3 priorities reflects really the 3 dimensions of sustainable development, and they are linked, and they guarantee really transversal consideration of the sustainability at the Geneva University Hospital. This will be our priorities until 2030. And really the idea is to set goals, and that's what we've done, and it's in the process of validation with our board of directors by the end of June. And we have also a very specific and dedicated action plan for 2025, and a review will be performed, and we will have a second action plan for 2026 to 2030. To elaborate the strategy, really the idea was to have a participative approach and not have a strategy written by the sustainability officer or a few specialists within the hospital. The first step we took was really an internal step. We had a brainstorming workshop with 50 people, more or less working in specific domain, to establish really the first, establish first the problem and then the possible action. In the beginning of this year, February and March, we had a past participatory platform on the web. It's a website. You can still consult the website. You have the web link here, but everything is in French, sorry. And it was open to all the hospital employees, also to our patients, our stakeholders, and to the Geneva general public. We had a lot of contribution at this stage, and we wanted also to include our employees who had less access to digital tools. So we had also internally a certain amount of contributive workshop with those employees. The first step was really framing the process, identifying the problems, deep diving in and exploit the issue we have. So on the issue of climate and health, on the issue of equality, diversity, and inclusion, and on the sustainable procurement and consumption. And it was held with a workshop. We had, as I told you, 50 participants, but 36 were very regular and came to all the workshops. Some, especially doctors and nurses, could not attend all the workshop, but it was really a common work, and it was really coming from the specialists within the hospital, knowing their work, knowing their specialties, to really have and identify the problem and formulate the adequate action we have to take between now and 2030. After that, we designed a web platform with a few objectives, some measures. It was a list of proposition we had, and that we opened to votes, comments, and also to new ideas coming from the employees, from our stakeholders, and the general public. We had 441 participants within the hospital who contributed, and an additional 100 persons coming from outside the hospital, mostly patients, but also suppliers and inhabitants of the community. We received more than 150 propositions, and more or less 60% of this proposition are included in the final strategy. Some of the propositions were already in place, so it was not just a problem of communicating what we're already doing well, and some were not completely aligned with the three strategic goals we have. So it's propositions that we will take into action in the next years, but it's a specific one, so it's not included in the strategy. It was almost the same content for the workshop with a less connected employee. You see here some of our cooks and restaurant employee. We also did that with people doing the laundry, the technical teams, and so on. It was more focused on their concerns, but they also were very active contributor, and they had very practical suggestions to make. So it was really interesting to enroll also this population and collect their contribution within the strategy. And it really was something, an addition to the action plan we had designed for 2025. We are now at so after all this participative approach, we finally wrote down a final document, including all the contribution we had. We also gave feedback to all the people that contributed, and we're now at the step of approval. So the executive committee already approved the strategy at the beginning of this month, and the board director will have the document for approval by the end of June. And after that, we will go to the next step, the launch and implementation and communication step, and the work will begin. Thanks.
Thank you. Thank you so much, Sophie. It's really good to hear how you are engaging with members of the public and stakeholders and staff to really create your strategy and make it as durable as possible. And also to hear how you've integrated other dimensions to the sustainability story. So it is about, carbon, but it's also about justice, and it's also about some of the social determinants. So thank you for that wonderful example. I've got some questions for you, Sophie, because I know you've been working in sustainability for a long time. You've worked in other sectors as well, but we've got around the world all these organizations and these health systems that have committed to becoming sustainable and to achieve net zero. So what do you think are the greatest challenges for a hospital to become sustainable and achieve net zero?
Maybe something I did not mention in my previous presentation is that we also did a carbon footprint calculation for the hospital because it was really necessary on the climate and health part of the strategy. So we are having quite great challenge with our building and our energy system. I think this is something quite common everywhere in hospitals. The second challenge for us will be decarbonizing our procurement supply chain, coming from medical device to food to medication, which is a big part of our carbon footprint. More or less 20% of our carbon footprint is coming from medication. And the last part, and on a very different topic, is really the way employees are coming to work. So commuting is also quite a big part of our carbon footprint. Maybe this is not something that will be worldwide the same. Maybe it's more something for Europe or northern countries, but and this is something that can really be a co-benefit for our employee health and for the climate, is that they become more sustainable on their commuting.
Thank you very much. I know that you're right, the procurement is such a big one, and how we sort of tackle medicines is going to be key. Certainly the NHS is also looking at how to change the whole landscape of procurement for healthcare in relation to carbon. So I'm hoping that there will be greater collaborations around Europe and around the world on how we might do that. One of the thoughts I've been having, Sophie, and this is, I know you're a member of the Geneva Sustainability Centre steering group, as is Nick Watts as Chief Sustainability Officer for the Greener NHS. So and one of the things we've been talking about is how we need to collaborate in order to achieve greater impact and transformation. And I guess I was thinking that there's several areas where that might be. Some is about education of health professionals, for instance, and what's included in their curricula. It might be that it's, like you've highlighted, around procurement and the sort of market transformation. Some of it might be about innovation, because actually some solutions that you might have in Switzerland might be useful in the UK or around Europe, or maybe some of the solutions that come from other countries like in Africa might be useful to bring to our overly resourced settings. Do you have any thoughts on how we could do that, well? Or what would you like us to do to help you do it better?
Yeah, well, I think it's really something we have to do together and not reinvent everything in each hospital or each hospital federation around the world. And having inspiring and successful story to tell and to get inspired by others is really useful. For example, at a very small level in Switzerland, we have a group within the university hospital, and we were really sharing the successes, but also, well, the more challenging and difficulties we're having. And I think this is really key. We don't have time to do everything on our own, and it's really something we have to share and inspire each other and really, well, so reinvent things. And education is key for me, coming from, well, you were saying I'm coming from another sector. I was in the aviation sector before, and I really think we have to accelerate and really have to educate the healthcare sector, who seems to be less aware than other sectors so far. But in 2 years, I saw a lot of changes. So I think it's on the way.
Yes, thank you. I do think that it is we're in a period of great change, and the NHS plan was a great precursor to, for instance, all of the countries that have signed up to some commitments around this. And I am sure that there will be lots of space for collaboration for all of us to share knowledge, And like you say, it's not just about sharing the success, but it's also sharing where things haven't been so easy, or where there's challenges, or maybe where we might have stumbled and we could have done it differently. I think everybody likes to also understand the lessons that are learnt through things not always working as well as we might like. So thank you for that. I would like to, I think we've reached probably the end of our time. I would really like to thank you, Sophie, for sharing the participatory approach that you're taking at the Geneva University Hospitals, because I think it's a wonderful way of making sure that everybody's involved, that it's not a specialist subject, but also to make sure that we feed on this collaboration, and also make sure that it's embedded in every aspect of healthcare. It's not just about buildings or transport or procurement. It's also about every decision that is made at every level in every aspect of healthcare. So I'm hoping that all of you who've been listening to us would like to join this journey. I'm sure many of you are already well on your way. And we'd love to hear from you about what you think is most needed to support chief executives to really make this the biggest ambition that they have got for their organizations going forward. We've got 3 years to make a difference. So let us know what is going to actually tilt the balance in that time. Thank you very much, Sophie, and thank you, everybody.
Thank you, Sonia, for the invitation, and I look forward to hearing what you're all doing around the world and connect. Thank you.